Hey guys, welcome back. I'm back with another video of co-trimaoxazole and quinolones. First of all, let's see about the co-trimaoxazole. Co-trimaoxazole is a fixed dose combination of trimethoprim and sulfamethoxazole is called co-trimaoxazole. Trimethoprim is a diaminopyrimidine related to the anti-malarial drug of pyrimethamine, which is selectively inhibits bacterial dihydrofolate reductase. Co-triamoxazole in 1969, which blocks the folate metabolism. Trimethoprim is greater than 5,000 times more active against the bacterial dihydrofolate synthetase than against the mammalian enzyme. Human folate metabolism is not interfered at antibacterial concentration of trimethoprim. Sulfonamide and trimethoprim are bacteriostatic, but combination becomes bactericidal against many organisms. Sulfamethoxazole and trimethoprim combined because of nearly same half-life, about 10 minutes. Optimal synergy exhibited at a concentration ratio of sulfamethoxazole about 20 and trimethoprim about 1. 20:1 ratio of the sulfamethoxazole and trimethoprim. The minimum inhibitory concentration of each component may be reduced by 3 to 6 times when 2 are given in a dose ratio of 5:1 because trimethoprim enters many tissues, has large volume of distribution than sulfamethoxazole and attains lower plasma concentration. However, concentration ratio in many tissues is less than 20:1. Trimethoprim crosses blood-brain barrier and placenta, where sulfamethoxazole has poorer entry and rapidly absorbed than sulfamethoxazole. Trimethoprim and sulfamethoxazole. Trimethoprim about 40% and sulfamethoxazole about 65% bound to the plasma. Resistance. Bacteria capable of acquiring the resistance to the trimethoprim, mostly through plasmid mediated acquisition of dihydrofolate reductase, having lower affinity for inhibitor. Longer period of combination, reduced responsiveness of over 30% originally sensitive strains. Then we goes to the adverse effects. Nausea, vomiting, headache, rashes are the usual adverse effects of the co-triamoxazole. Folate deficiency, megaloblastic anemia occurs only in patients with marginal folate levels. Note, it should be avoided during the pregnancy. Trimethoprim, antifolate, which is a teratogenic risk. Neonatal hemolysis uremia, which is dose should be reduced moderately, severe renal impairment. Diuresis and co-triamoxazole, higher incidence of thrombocytopenia. Uses of co-triamoxazole are urinary tract infections, respiratory tract infections, bacteriodiuresis, dysentery, myositis, synovitis. In urinary tract infections, 4 tablets of co-triamoxazole for acute cystitis, course about 3 to 10 days for the lower and upper urinary tract infections. Co-triamoxazole available for chronic or recurrent cases or in prostatitis because trimethoprim is concentrated in the prostate. In the respiratory tract infections, both upper and lower infections including chronic bronchitis and facial-maxillary infections caused by the gram-positive cocci and H. influenzae. Here comes the next topic of quinolones. Quinolones are the synthetic antimicrobials having a quinolone structure active against the gram-negative bacteria. Newer fluorinated compounds also inhibit gram-positive bacteria. First member, naldixic acid, introduced in 1960s, usually limited to the urinary and gastrointestinal infections because of low potency, modest blood and tissue levels, restricted spectrum and high frequency of bacterial resistance. Naldixic acid active against gram-negative bacteria, especially coliforms, example E. coli, Proteus, Enterobacter, Shigella, but not Pseudomonas. Acts by inhibiting bacterial DNA gyrase and is bactericidal. Nalic acid is absorbed orally, highly plasma protein bounded, partially metabolized in liver. Of one of the metabolites is active, excreted in urine with plasma half-life about 8 hours. High concentration attained in urine 20 to 50 times that in the plasma, and gut lumen is lethal to the common urinary pathogens and diarrhea causing coliforms. Adverse effects of quinolones: gastrointestinal upset and rashes. Important toxicity is neurological, headache, drowsiness, vertigo, visual disturbances, occasionally seizures, especially in children. Uses of quinolones: naldixic acid, primarily used as a urinary antiseptic, generally has a second line drug in the recurrent cases or on the basis of sensitivity. Nitrofurantine should not be given concurrently, which causes the antagonism. It has also been employed in diarrhea caused by the Proteus, E. coli, Shigella or Salmonella, but not norfloxacin, ciprofloxacin are commonly used now.